Well, a couple of things just in terms of how this whole thing got paid for. First of all, I think it's really important to point out here that the total cost of the Affordable Care Act to provide health insurance for every American out there at an affordable rate is costing about the same amount over the course of 10 years as the costs of the prescription drug bill that President Bush passed, except that wasn't paid for. We felt obliged to actually pay for it and not just add to the deficit. So what we did, it's paid for by a combination of things. We did raise taxes on some things. We, for example, said that for high-income individuals, you can pay a slightly higher Medicare rate, Medicare tax. So we bumped that up a little bit. We said that for employers who are currently providing a so-called Cadillac health care plan, where there's so many bells and whistles, there's no incentive to actually spend wisely when it comes to health care. We're actually going to penalize you for that, not only to raise a little bit of money, but also to say you're encouraging the worst aspects of a health care system where you spend a lot of money, you don't get better outcomes. I mentioned to you Medicare. We basically said there's a program in Medicare called Medicare Advantage that provides some additional options for Medicare recipients above and beyond standard Medicare. And it's very popular with a lot of seniors. You get, eyeglasses and, other benefits. But it turned out that it was so uncompetitive that we were providing tens of billions of dollars of subsidies to the insurance companies under this Medicare Advantage plan without getting better outcomes, health outcomes for seniors. So what we said was, we'll keep Medicare Advantage and we'll give them a small premium if they're providing better services for seniors, but we're going to make you compete for it a little bit, and we're going to save tens of billions of dollars in the process, and that will go into paying for the Affordable Care Act. So the bottom line is, through these various mechanisms, we raised enough money to pay for providing health insurance for those who don't have it, to provide these health or these tax credits in the marketplace, and at the same time, because we're driving down costs, we actually end up saving a little money. It is a net reduction of our deficit. The irony of those who are talking about repealing Obamacare because it's so wildly expensive is, if they actually repealed the law, it would add to the deficit. It would add to the deficit. Now, there have been a couple of Republicans in the House who've been smart enough to say, we're going to repeal all the benefits so that people, 25, 30 million people don't get health insurance, but we're going to keep the taxes that Obama raised. We just won't talk about that. And then that way we can say we reduced the deficit. Obviously you're doing some funny business there with the budget. But look, nothing is free. The bottom line, though, is, do we want to continue to live in a society where we've got the most inefficient healthcare system on earth, leaving millions of people exposed to the possibilities that they could lose everything because they get sick, where we've got little children and families going to the emergency room once a week because they got asthma and other preventable diseases because their families aren't linked up with a primary care physician who's providing them regular care, where the costs to society for reduced productivity, illnesses, etc., all burden our businesses. Is that the kind of society we aspire to? I think the answer is no. And the notion that we would resist, or at least some would resist as fiercely as they would, or as they have, make this their number one agenda, is perpetuating a system in which millions of people across the country, hard-working Americans, don't have access to health care. I think is wrong.